innovative response to menstrual stigma in global health. FlowWise. Hi, my name is Saya Isabella Malek. I'm from Houston, Texas, and I'm a rising senior at the Kincaid School. I currently serve as an ambassador for the PAD Project, a global nonprofit. Through this role, I've led many donation drives, collecting over 1,000 menstrual products and distributing them to underserved communities across several countries. Last year, I served as the vice president of my school's Girls Who Code Club, and this upcoming year, I will serve as president. I've conducted research on menstrual equity and breaking the stigma, working closely with OBGYNs to create educational resources as the one seen on the slide here. And I'm the creator of FlowWise, which is a multilingual educational menstrual health app that I'll be presenting today. I'm very passionate about global health, especially women's health, and the integration of education, equity, and technology. There are over 5,000 euphemisms for menstruation worldwide. In Hungary, people say Santa Claus has arrived. In Nepal, menstruating girls are deemed untouchable, reflecting deep-rooted stigma. These aren't just cultural quirks, they're symptoms of something deeper. My presentation today is about menstrual stigma, how it operates through language, culture, education, and technology, and why it has become a serious global health crisis. Here's why it matters. Stigma teaches girls to stay silent about their pain. That silence leads to missed school and opportunities. A UNESCO report estimates 1 in 10 girls in sub-Saharan Africa miss school during their period, sometimes up to 20% of the school year. Undiagnosed conditions like endometriosis or anemia. Mental health struggles rooted in shame. A large study of adolescent girls in Uganda found menstrual pain, poor hygiene, and lack of knowledge correlated with higher scores of mental health distress. And widespread misinformation, because when something is taboo, it's not taught, and when it's not taught, it's misunderstood. This stigma is being coded into the tools we rely on. Most period tracking apps are designed by men, and many have been caught selling sensitive user data. Social media platforms censor and suppress posts about periods, even when they're educational and medically accurate. AI health tools trained on male-dominated datasets consistently misinterpret menstrual symptoms, especially for women of color. This is the purpose of my presentation, to expose how menstrual stigma, reinforced by both language and technology, is silencing and harming menstruators globally, and to share FlowWise, a menstrual health platform I created to fight this crisis with education, cultural sensitivity, and technology that actually serves the people that it was meant for. FlowWise is a progressive web app, or PWA. That means it works without needing to be downloaded, it uses low data, making it accessible in low resource areas. It collects zero personal data, it contains no advertisements, and it is completely free to use. The app is currently available in 4 languages, with more in progress. The video here shows the user toggling between English, Spanish, French, and Portuguese. That multilingual design is intentional because menstrual education must be culturally relevant to be effective. FlowWise was designed specifically for youth without access to formal education, communities where menstruation is still taboo, and users who may feel unsafe asking questions in person. The platform includes many features, each built to tackle a specific consequence of menstrual stigma. The first feature of FlowWise is a symptom input quiz and guidance dashboard, designed to fight one of the most harmful effects of menstrual stigma, the normalization of pain. Too often, girls are told their suffering is just part of growing up. But that message leads to misdiagnoses of serious conditions that go untreated for years. This quiz offers a private, non-invasive way to reflect on their symptoms through questions like, how long is your period? Do you bleed between cycles? Based on their answers, they're placed into one of 3 tiers. Sounds typical, receiving basic education, track and monitor, encouraged to journal symptoms and use Ask Flow, which is a feature I'll discuss more later, or talk to a doctor, receiving a downloadable PDF of symptoms to bring to a parent or guardian, school nurse, or a healthcare professional. Importantly, no personal data is required and no answers are stored or sent anywhere, so it's safe even for users in high stigma households or environments. This quiz is intended for educational use only. It does not replace professional medical advice, and users are always encouraged to consult a healthcare provider for personal medical guidance. This tool directly tackles delayed diagnosis, access barriers, and the lack of safe language to describe menstrual health. The second feature is Period Atlas, an interactive resource that helps users explore how menstrual stigma and access vary worldwide. Many health tools assume a one-size-fits-all model, but stigma, myths, and taboos differ by culture, and effective education needs to reflect that. With Period Atlas, users can click on over 100 countries to see common local euphemisms for menstruation, levels of access to products like pads, tampons, or menstrual cups, as well as the average monthly cost, cultural myths and taboos that shape stigma, and translated educational materials tailored to each region. For example, as seen in the video clip here, a user in France can access French language resources on menstrual health and the phases of their menstrual cycle. This feature promotes health equity by making education culturally relevant and multilingual. Period Atlas reframes menstruation not as a private burden, but as a shared global experience and gives users the tools to learn without shame and wherever they are. The third feature of FlowWise is Ask Flow, an AI-powered chatbot designed to give menstruators empathetic, stigma-free answers without the bias found in mainstream health tools. Most AI chatbots are trained on datasets centered around white, male Western populations. As a result, they often misinterpret symptoms, dismiss pain as normal or stress, and fail to recognize how menstrual health presents across different bodies and cultures. Ask Flow was built to challenge that. Not only does it answer all of your menstrual health questions, but it also includes myth or fact quizzes, a period euphemism translator, and a simple tracking tool for users to log their cycles. Ask Flow is trained with multilingual and culturally sensitive inputs and a strict no data collection policy. It's available 24/7 with no shame in asking anything. The final feature of FlowWise is the Community Q&A Hub, built for users who are afraid to ask or who have no one to ask at all. All around the world, Stigma teaches menstruators that their questions are embarrassing, inappropriate, or disrespectful. As a result, they turn to the internet, only to be met with misinformation, ridicule, or silence. This feature provides a safer, judgment-free alternative. Users can submit questions anonymously, upvote helpful responses, and view answers from verified OBGYNs, nurses, and global health mentors. All answers are moderated, tagged by topic, like irregular periods, or cramps and pain. This space replaces isolation with empowerment. It directly addresses shame-driven silence and a lack of access to trusted health professionals. Today, I've talked about menstrual stigma, how it operates through language, culture, and technology, and why it's a global health crisis that causes real harm. And my goal was to show how it can be challenged through inclusive, stigma-free design. And that's exactly what FlowWise was created to do, to make menstrual health education multilingual, medically sound, and accessible to everyone. Because stigma isn't just a personal problem, it's a systemic one. And if we want to close health gaps globally, we have to start by naming ones we've been taught to ignore. My call to action is this: if we can build technology that silences people, we can build technology that protects them. Here are my references. I'd like to acknowledge my supportive family, the Global Health Leaders Conference, and you, the audience, for listening. Thank you again, and here's my contact information.